NCLEX questions on mental health. Some definitions. To note. Paranoids is feeling extremely nervous and worried because you believe that other people do not like you or are trying to harm you. Schizophrenia involves a disconnection from reality, including hallucinations and delusions. Delusions are false ideas or beliefs that someone holds on to, even when there is evidence that they are not real. Hallucinations seem to see, hear, feel, or smell something that does not exist, usually because of a health condition or because you have taken a drug. Questions. 1. The nurse is caring for a client with schizophrenia who is experiencing delusions. Which of the following nursing diagnosis would be appropriate? A. Impaired verbal communication. B. Ineffective role performance. C. Disturbed thought processes. D. Disturbed sensory perception. Two. The nurse is reviewing the chart of a client who was recently diagnosed with schizophrenia following graduation from college and notices that the date coincides with the date of the client's mother's diagnosis of schizophrenia. The nurse evaluates the major risk factor contributing to the development of schizophrenia in this client as A. A recent search for employment. B. Being from a low socioeconomic class. C. The mother's genetics at the time of diagnosis. D. Being recently divorced. Three. A newly married client is delusional and believes that his partner is having an affair with the next-door neighbor. Which of the following is the priority that will lead the nurse to expect that these delusions will incapacitate? A. He will predominantly be affected at work. B. He will be consumed by his thoughts. C. These beliefs will not have any effect on him. D. These beliefs will affect his social relationships. Four. A well-known substance user is brought to the emergency department because he has been threatening peers with a knife and accusing them of having an affair with the client's partner. While making the assessment, the nurse understands that psychosis is most likely related to A. Marijuana use 2 days ago. B. Using methamphetamine tonight. C. Use of alcohol over the last week. D. Use of a friend's tranquilizer. 5. A nurse using the downtown transportation system in a large city sees a homeless woman sitting on a park bench. The woman is talking to herself and frequently looks over the empty space on the bench beside her. What's the best explanation to this situation? A. The woman is experiencing auditory and visual hallucinations. B. She was speaking on her cell phone by using the headset. C. The woman is lonely because she is homeless. D. She was calling on her friend down the street. Answers. C, D, B, A.